Thank you. Good afternoon, everyone. Welcome to the Assembly Committee on Commerce and Labor. Madam Secretary, please call the roll.
Assemblywoman Carlton.
Here.
Assemblywoman Considine.
Present.
Assemblywoman Dickman. Assemblywoman Dickman. Assemblywoman Duran.
Here.
Assemblyman Flores.
Present.
Assemblyman Frierson.
Here.
Assemblywoman Hardy.
Here.
Assemblywoman Kasama.
Here.
Assemblywoman Martinez.
Present.
Assemblywoman Marzola.
Here.
Assemblyman O'Neill.
Here.
Assemblywoman Tolles.
Here.
Chair Howdigi.
Here. Thank you, Mr. Secretary. Please mark members present when they arrive. And welcome to everyone tuning in over the internet. We have a short agenda today, 3 presentations, but before we get started, I would like to go over some quick housekeeping rules. Persons wishing to testify must register online at www.leg.state.nv.us. The public is strongly encouraged to submit written testimony in advance of the meeting, and they can do so by emailing their testimony to asmcl@asm.state.nv.us. Members, please remember to keep your camera on at all times. This will help ensure that we have a quorum at all times, unless you are stepping away from your computer for non-committee related business. Members and presenters, please remember to keep yourselves muted at all time and then unmute to speak, and then promptly mute yourself when you are done. Our first item on the agenda today is the presentation by the Board of Medical Examiners. I believe we have the Deputy Executive Director, Sarah Bradley, present for the presentation.
Yes, you do, Madam Chair.
Ms. Bradley, please introduce yourself and begin when you are ready. Thank you for joining us today.
Thank you. So my name is Sarah Bradley. I am the Deputy Executive Director for the Nevada State Board of Medical Examiners. And I provided a handout that I hope you all received, just to give you a little overview of the board. So the Nevada State Board of Medical Examiners is a Title 54 licensing board, and the chapters that the board uses are NRS Chapter 630 and NAC Chapter 630. The board is the oldest licensing board in the state of Nevada, and we have a creation date of March 15, 1899. The board has 2 investigative committees, and those are made up of board members. So we have 9 board members. We have 2 investigative committees. There's 2 physician members on each committee and a public member on the committee. We have a total of 6 physicians on the board and 3 public members on the board. The board licenses 4 profession types: medical doctors, physician assistants, practitioners of respiratory care, perfusionists, and we also have residency training licenses that we provided for you on the handout so that you can see the number we have in that category as well. We have advisory committees of each of the physician assistant, respiratory care, and perfusionists that can help advise the board on issues related to those professions. The board has 2 offices, one in Reno, that's our main office, and then we have an office in Las Vegas. We're actually really excited that we just moved locations in Las Vegas, so we have a bigger space with more availability to have board meetings and other things occurring in our Las Vegas office, so we're excited about that. And the board, I highlighted for you here, so I wanted you to see we have new licenses we've issued, actually more in 2020 during the pandemic, but we are increasing. So last year, the total new licenses was 1,648, and in 2019, it was 1,469 new licenses. And I did break them down for you in each of the categories. And as far as disciplinary actions go, last year there were 501 investigations opened. That includes complaints obviously received by the board, and it does not include things that were sent to us in error. If it was about another, something we don't have jurisdiction over, or somebody that does not license by us, we forward those to the appropriate entities. So 501 investigations were opened, and then last year 620 investigations were closed. Obviously there were some from the prior year. There were disciplinary action in 32 matters, public disciplinary action. And then the most frequent kinds of complaints we receive: standard of care, so that would be anything related to patient care. Prescribing is also related to patient care, but we kind of categorize that one a little bit separately because it's such an important issue. Demeanor, we get a lot of those complaints where someone is upset with the way they were treated by their physician or physician assistant. Records, we have two kinds there. The most common probably that we do discipline with is going to be where the records are not timely, legible, accurate, or complete. That's required by statute, and that's an issue that we see issues with frequently. We also have situations where patients are requesting records and not receiving them timely, and so generally we get involved and help the patients receive the records that they have requested from those doctors. And then significant accomplishments, just to highlight, we're really excited about new licensing software that we have. This software it allows us to have a portal for all licensees, so they can actually go online, create an account, and then they're able to view their address and things like that, and they can make real changes live, which will be really nice. They'll also be able to renew online, and they can even contact us and see documents, things like that, upload continuing education. So it will be a lot more interactive for our licensees. So we're really excited about that. And for our new applicants, they will be able to do the process entirely online, which is new for us. We've always done renewals online, but now we will do new applications as well. As far as outreach and education, that's something the board does try to do so that our stakeholders around the state are aware of our operations. Last year, obviously, you can imagine we didn't do as many given COVID, but we did do a presentation to the PA program at UNR, which was really, I thought, fun. I like doing those sorts of things. And then we also have a website that we helped to put together. It's sponsored by the Nevada State Board of Nursing, the Pharmacy Board, and our board, and it's about prescription drug abuse. And so consumers can go there and learn about different drugs that they're taking, side effects, things like that. And there's helpful resources there for consumers. We have a link to that site as well from our main website. And then the other thing we wanted to highlight was increased staffing. So we are growing with our licensing numbers. Our complaints, as you can imagine, are also increasing. And so we have hired new staff last year. We are planning to hire new staff this year in order to keep up with all of our operations so that we can better serve our new applicants and our licensees. So those are the things I had planned to say. And if there's any questions, I'd be happy to answer them.
Committee members, do you have any questions? I don't see anybody raising their hands, and I just actually had a quick question, just out of curiosity, since you said that some of the complaints you guys address are with records and the timeliness of receiving them. What is a normal turnaround time to receive records or records requests?
So in NRS Chapter 629, I believe they have 5 business days if the records are stored in Nevada, and 10 if they're stored outside to provide those records. And so generally when we get a complaint, it's past that time frame. I would say, though, they're not excessive, meaning I have dealt, so my entire career has been with licensing boards, and I have seen times where licensees took more than a year to provide them. We don't have that situation. So generally speaking, it's someone who needs their records for whatever reason, hasn't received a response. Usually it's a miscommunication in the office of some kind. And usually we're able to call and get that taken care of immediately. I would say not more than a month is what we're looking at in the cases we have. But if you want more specifics, I can certainly get that from our Chief of Investigations.
Oh, no, that was actually perfect. That's exactly what I was looking for. Thank you, Ms. Bradley. Committee members, does anyone have any questions for the Board of Medical Examiners?
Yes, Madam Chair, I do, very briefly, if I may.
Yes, Vice Chair Carlton?
Thank you. So could you give us an idea of about the turnaround time on licensing right now? And about how long is it taking to get the fingerprints back? We've had issues with that over the last couple of biennia, and it was getting much better. But I just wanted to check to see how long it actually takes to get the license processed and get the fingerprints taken care of.
So I have a cheat list here, checklist here. So when we have a completed application, we can actually issue the license within a day or the next business day. It does sometimes take a while to have that completed application, and I think we're averaging about 2 months. Oh, 50 days. I apologize. My chief of licensing is here with me. So 50 days is the time we're averaging to have a completed application. So that's from when they start it to when they complete it. And then, as I said, on that 51st day, they would be licensed. And then as far as fingerprints, I know we had some issues during COVID with not all of the centers being open for fingerprinting. But what is the time frame? I'm asking.
4 to 6 weeks.
So it's still 4 to 6 weeks for us to get the fingerprints back.
Thank
The
you,
results.
Madam Chair.
Thank you, Ms. Bradley. Thank you, Vice Chair Carlton. And then I have one quick last question, Ms. Bradley. I saw that you issued a total of 1,648 licenses in 2020. How many applications did you receive in total?
I can find that out and send that to you. I don't have that number off the top of my head. I can tell you, I don't believe we rejected any applications. So there would have probably just been maybe some that were received and not issued before the end of the year. But I'd be happy to follow up with the committee and give you that exact number. And I apologize that I don't have that on this handout.
No, that'd be perfect. If you could just send it to the committee, that would be great. That would work. Perfect.
Okay.
Assemblywoman Marzola, did you have a question?
I did, but she just answered. Thank you.
Okay, perfect. Okay, let's see. One last call, committee members. Any other questions? Okay, well, thank you, Ms. Bradley, for joining us today and giving us an overview on the board. We appreciate your time.
Thank you.
Okay, our next presentation is going to be the State Board of Osteopathic Medicine. And I believe we have the Executive Director, Sandy Reed, here with us today to give us an overview of the board. Ms. Reed?
Hi, Madam Chair and committee members. Can everyone see me?
Yes, we can, Ms. Reed.
Perfect, thank you. As you know, I'm the Executive Director of the Nevada Board of Osteopathic Medicine. We license osteopathic physicians and physician assistants. Those are the only two occupations we license. We are governed under NRS 633 and NAC 633. Our board consists of 7 members, 5 are osteopathic physicians, and 2 are public members. We have 4 full-time staff, including myself. The staff are a licensed specialist, a complaint specialist investigator, and an administrative assistant / licensing assistant. Everyone does about 2 jobs. We are a board who meets monthly, so we license fairly efficiently. The only month we don't meet is in July. And we have approximately, for this fiscal year so far, we have over 2,279 licensees. That includes active, inactive, resident, DOs, PAs. And we've grown exponentially since when I first started 4 years ago. The licensing total was almost 1,800. So we've grown over the last 4 years. We basically, our licensing process can take from, depending on if it's a clean license, it can take around 60 days or so. I think you should have a flow sheet that shows our licensing process that we submitted to the Federation of State Medical Boards as to how our processing works. It goes through 2019 because we did it last year, but it gives you an idea of how our licensing occurs. We, due to COVID, we have now allowed when fingerprints that are submitted for applications, we can license someone without waiting for the fingerprints to come back. Because they will state on their application whether they've had previous discipline. And to this date, that has worked out. We have not had anybody who has pretty much was deceptive on their application, stating they had no discipline or arrest, and then would later come back. So that has increased the efficiency of licensing, which could be around 30 to 45 days. We get that due to the fingerprint change. Another way we can speed up the fingerprinting is by having it done electronically, rather than the hard copies that are sent. So that has helped as well. Licensees can apply either, they can renew online and apply online, or they can download the application, complete it by hand, and send it in. We have two different ways. Most people do it online, they can pay online. So that's a fairly efficient process. We do renewals once a year, December 31st, for all our licensees, except for residents who are renewed annually after they are issued a license, a one-year license. And the fees for residents are lower than the regular licensees. Recently, a year and a half ago, we did a review of our fees to evaluate and see if our fees were a little bit higher, which we thought they were than some other boards. And we based it also on our reserve policy. So we lowered our fees $100 for licensing and for renewals. That was under regulation RO 1119. That was approved, and our new fees were implemented in January 1st, 2020. So that is assisted. Actually, our licensing applications have gone up. I don't know if that's the reason, but since that passed, we've had an increase in licensing. We're also members of the License Medical Compact, which is interstate and allows license portability between states. And people can once their application comes in, which is minimal amount of paperwork. They don't need the same proof that they do for regular licensing. If they were coming through Nevada, they can be licensed within 10 days. Because there is what's called a state of principal licensure, which is kind of an anchor state that does all that background information. And once that state approves this type of compact license, they can then use other states as subsidiaries, so to speak, but they would still be regularly licensed. It just would be a quicker process. And a lot of physicians using telehealth have found this license portability to be quite advantageous for them, and it serves the public better throughout the country. So we've been a member of that group since I think it was around 2015, the legislature approved it. And our disciplinary actions, we don't have extra committees because we're a small board. So the way our discipline works is we may get a complaint in, and then I will review it, and the investigator will prepare the case, the process, get all the information, and then I will assign it to a board member, one board member, who will review all the information. And at this point, it's all confidential. And then until that board member decides either to dismiss or discipline the person, that's up to the board member. So most of our cases are dismissed, about 80%. And the ones that we do go for discipline. A lot of times we'll use a settlement agreement, and then the settlement agreement is written by our board counsel, and then myself will look at it, and the board member who was the quote unquote investigator on the matter. And after that's all approved by the licensee and this board member, we will present it to the board for final approval. And every case is viewed individually on how discipline is handled. Then you have, I don't know if you have you might have the handout sheet of all the statistics as to how many, that what I've sent to you is basically the calendar year for last year. How many complaints were reviewed and investigated? 81. How many were settled? 1. Letters of caution, which is also letters of concern, 13. How many were closed? As you can see, 67 were closed, meaning dismissed, typically. And so most of them are dismissed. And then we also have different types of complaints. The medical malpractice, we had 14. Prescribing matters, 3. Standard of care, 29. Unprofessional conduct, 31. Non-reporting, 1, if they don't report that they had an action. And then we've had several that were out of our jurisdiction. And note that some of these complaints do overlap. Let's see. That's the general information about our board. Is there anything else, anything you'd like to, if you have any questions, I'd be happy to take them.
Thank you, Ms. Reed. I appreciate the presentation. Committee members, do you have any questions for Ms. Reed? Let's start with committee members first. Okay, I don't see anyone raising their hand. So I do have a couple of questions, Ms. Reed, regarding the compact. So I know to get a license, you said it's about a 60-day process for a new licensee. For the compact, you said it was about 10 days for them to get their license here in Nevada. Do they still have to fill out the same application that a Nevada licensee would fill out and provide the same information as far as like do we still do the background checks and?
They do not fill out the same application because they go through, it's called like a centralized portal. It's the Interstate Medical Licensure Compact. There's a website and it has a portal where people can apply that way. It's all done through this. It's like a Grand Central, a location where they can get their licensing. So if they want let's say if we're a member state, meaning they have their anchor license, so to speak, from another state, they get approved to have a regular license, let's say in Colorado. Colorado will do most of all the background check and they will ask whatever they need of that person for them to be licensed. Once they approve that, they will send what's called a letter of qualification, and that will be in that person's application. Once that is issued, all the other states that the provider, and this is only for physicians, we don't have physician assistant compacts. Once that they apply to the other states, that's why the process goes quickly, because the main state, the state of principal licensure, has done the checks. Now, we as a state can ask for background checks, and we do. I think we do ask that just to make sure, but the paperwork is more minimal, and we're basically going by what the anchor state, we're agreeing or approving what their process is. That's how the compact is set up. But we can do additional work if we like. If there's something we see on the application that maybe doesn't look right, that maybe the anchor state bypassed, we can ask about it. We can look into that. But typically, once everything is done, I submit it via, there's an online portal that I go in to approve it. The board has no involvement. Our board has no involvement with these applications and licensing approvals. They are not on our agenda. I approve it, and then the person has a full license. One other thing I would like to add is that one of the requirements for them to be licensed this way is that they have no disciplinary action. They can have a medical malpractice, but if there's any disciplinary action of any type, be it criminal or medical and from their board, they are not eligible. If there is anything that happens after they are licensed, they can be removed from the compact. Or if they do not renew their license from their anchor state, let's say it expires, all of their member state licenses will be invalid. So I hope that answers your question. If there's
No, it did. Thank you. I was curious because I saw the number go up like in 2000. I believe you said that we joined the compact in 2015. So the number of licenses in 2017 using the compact just increased a lot from 2017 to 2019. So I was just curious about the process. I did see what would just for my knowledge, because I saw on here that you actually added how many licensees you guys denied. So it was 2 in 2017, 1 in 2008, 1 in 2019. Could you just give us an explanation of what would be some of the reasons people would be denied a license?
Sure. So typically, it would be where someone falsified their application and they would not be fully truthful. There are sometimes when people apply and we have questions on our application. Have you ever been investigated? And they may say no. We'll go back. We give people opportunities. We say, oh, we found this on your record, because maybe they don't realize we do background checks, even though it is stated. That's one instance. If someone continuously, we had, I think, one case where someone continuously falsified all of his discipline and was not being upfront with what actually happened. So that, I remember in that one case, we brought the person in to meet before the board so the board could question him. So if the board is not comfortable with what they hear, that could be a denial. Another instance is where I know there was one person who came in from another state. He wanted to be licensed, but there was a lot of negligence in his standard of care. There were a lot of negligence in standard of care matters that were not fully explained. It just didn't make sense. So they were concerned about someone like that practicing in the state because there was many issues related that were recent and many years ago. So, and the board always gives someone a chance. They always say to the person, come to the board, let us ask you questions, bring an attorney if you like. And then it's rare for someone to be denied, but it happens. And those typically would be the reasons.
Okay, and I believe we do have some more questions for you.
Sure.
I am going to turn it over to my colleague, Assemblywoman Considine.
Thank you, Madam Chair, and thank you for the presentation. I just have a question about the complaints. I know that complaints are confidential unless the result becomes formal discipline, but are those complaints kept on file somewhere just in case like there's one person who like the complaints start to add up, or are they completely just dismissed and taken out? Thank you.
Complaints that are dismissed are kept for at least 3 years. And then after that, we can shred them. But to be frank, we pretty much keep everything on our server just to have it. But hard copies will shred just because there's so much paper. But we follow the guidelines of the public records. So we will probably have just about everything anyway on our server.
Thank you. Thank you, Madam Chair.
Okay. And Assemblywoman Marzola, I believe you had a question?
Madam Chair, Elaine Marzola, Assembly District 21. Just a quick question. On the question, have you ever been charged with or investigated or arrested? If any of those answers are a yes, is that an automatic denial? Are they allowed to provide additional information?
That is not an automatic denial. We will ask them for information. When I review the licensed person who collects all the information, the files for the application process before I review them, they will typically ask for backup or any information. If it's a court case, we will ask for court documents and the disposition, because we have found sometimes when people respond, they will not be fully upfront. So we like to see the court documents. We want to make sure see what the matter is. There might be multiple matters that are the same, that were not expressed to us. So we like to get all the information, but it is definitely not a denial at all. Sometimes if it depends on what it is. If it's a DUI from 10 years ago and there's been nothing since, driving under the influence, that's okay. And they fulfilled everything they needed to fulfill, we'll just put it on the agenda. If there seems to be a history, like even a recent history of something like that, or if there is a criminal violence or domestic violence, I will talk to our board president and say, I think we may need to bring this before the board for them to ask some questions. So we could do that, and then the board can decide.
Great, thank you so much.
Sure.
Committee members, any other questions? Okay, and I just have one last question, Ms. Reed. I was looking at the license types, and there's one on here that says temporary license, and there's only one that's been issued. Is that just for a licensee who may be coming in to practice for like 1 month or 2 months and just needs a temporary license and then goes back to their home state?
That's correct. We had a person who will it's up to 6 months we give them. And the licensing process is not as intense as the regular process, but they were filling in for another physician in the state. So that is what that is, yes.
So they can come in and then just apply for a temporary license, which would be 6 months, and then can they renew it? Or
That's a good question. I think, can they renew it? That I can look into that and get back to you. They might be able to, but I'd have to get back to you on that.
Okay, I was just curious. Maybe people would come into the state on a temporary license and just keep renewing it for.
Oh, no.
Okay.
That's not, no, we don't, that's why there's only one. No, I'm almost certain that if they wanted to stay longer and they thought they would stay, it would go to a regular process, or we would tell them maybe they'd like to go through the compact. That's another way they can come in. But no, we would never allow continual that I know of. I mean, we may allow it once. I can look into that and see. But
Okay.
I don't know 100%, to be frank.
Well, thank you, Ms. Reed, for your presentation. I don't see any other committee members with questions. Okay, so thank you so much, Ms. Reed, for your presentation and your time today.
Thank you.
Okay, committee members, the third item on our agenda today is a presentation from the State Board of Nursing, and we have the Executive Director, Kathy Denauer, here with us today.
Good afternoon, Madam Chair and members of the committee. Thank you very much for allowing me to speak. My name is Kathy Denauer, and I am the Executive Director for the Board of Nursing. The Board of Nursing was established in 1923 by the state legislature, and we have our chapter, NRS 632, that regulates the practice of nursing. And the Nevada State Board of Nursing is one of several Title 54 boards made up of 7 members appointed by the governor. That 7-member group includes 4 registered nurses, 1 licensed practical nurse, 1 certified nursing assistant, and 1 consumer member. And then the board appoints a Nevada licensed registered nurse to serve as the executive director. We have 2 offices in the state, one in Reno, one in Las Vegas, to best serve the nurses in the state. And we are funded through licensure fees, and we don't receive any general funding. So we have several functions: an administrative function, education, licensure and certification, discipline, and compliance. And I did provide you with a 1-sheet document that sort of summarizes all of our departments, and I'll just review that briefly. We license and certify 63,637, this is as of last week, individuals in our state. That includes registered nurses, licensed practical nurses, nursing assistants, advanced practice registered nurses, EMS nurses, certified nurse anesthetists as well. We processed 7,700 applications in fiscal year 1920, and the information I'm giving you is from that fiscal year. We just put out our recent statistics. We are able to issue a license. We issue temporary licenses to our nurses, and for a temporary RN license for someone that doesn't have any necessarily problems with their license, it's about a 3-day turnaround time, because we know that getting fingerprints can take a while to get those results back. But we will issue a temporary license in about 3 days. It takes a little longer for a nursing assistant because they have to provide us with documentation of employment. But other than that, it's a fairly short time frame. Our fees, as you can see on the document I provided, we have not changed the fees or raised the fees in 20 years. The next department that we have is our discipline department. And we received in the fiscal year 1920, 456 practice-related complaints. And we try to get a turnaround time. On the average, it's about 60 days to turn that case around for completion. We have 5 investigators, and they work pretty diligently in getting these cases done. We have an online system. I didn't mention that earlier. It's a web-based system, so it has really been very valuable in allowing us to continue during this COVID pandemic. We haven't had to worry too much about getting paper applications and whatnot, because everything is web-based. So we've been able to continue operations. Along with the discipline, I provided you with some of the types of complaints that we received in the last year. With nurse practitioners, those complaints generally involve prescribing and maybe over-prescribing or not prescribing appropriately. The RNs, it involves customary standards, failing to collaborate with the healthcare team, and acting outside their scope. And the CNAs, the primary complaints that we receive have to do with privacy, confidentiality, abuse, and patient abandonment. What I also want to mention within discipline is that we have an in-house alternative to discipline program. So for nurses who are experiencing some sort of a substance use disorder, they can enter our program. It is non-disciplinary. They temporarily relinquish their license or certificate. They are able to go get treatment. And then when they're ready to come back, they can come back, and they go into a 5-year agreement with us in which we monitor their practice. They have to drug test, they have to attend AA meetings, etc. If they don't participate in the alternative to discipline program, we do have a monitoring program for those who are on probation. So we handle all of that in-house. The next department we have is education, because part of our responsibility is also to regulate all the pre-licensure nursing programs, of which we have 14 in the state, and our CNA programs, of which we have 24. And as you can see also on the document, it shows the number of graduates that we have, nursing graduates this year from our nursing programs. And I will say that our nursing programs have done a stellar job during this pandemic in trying to manage clinical experiences for their students while students haven't been able to go into facilities for a period of time. During the pandemic, we have issued waivers. This is under the Directive 11 that the governor issued. And to date, we have issued approximately 2,800 waivers for individuals coming to the state that are not required to get a license in Nevada or certificate. I also want to mention that we normally, as a part of our function, we provide presentations all around the state. Pre-COVID, we were on the road quite a bit, providing presentations to nursing students, recent graduates, nurse practitioner students, but we haven't been able to with COVID, but what we've been doing are virtual meetings. So anytime that somebody asks us to do a presentation, we're happy to do so, because we want to make sure that we have safe safe individuals out there practicing. We have 6 advisory committees that advise the board, and they vary from a nurse practice committee, a nurse practitioner committee, CNA, an LPN committee, and a disability advisory committee. I hope I haven't forgotten any. And they meet, and an education advisory committee and a CNA. And they meet on a fairly regular basis and review policies and standards of care and practice, and advise the board on evidence-based issues. Legislatively, this session, we are looking for two big pieces of legislation. The first is the Nurse Licensure Compact. We are not part of the compact currently. 34 states are. The compact would allow a nurse to have one multi-state license in their primary state of residence and practice in other compact states. It's an important tool in removing barriers to licensure and expanding our healthcare workforce and preparing us in responding to public health emergencies. The second piece of legislation is a BDR 5460 that's sponsored by Majority Leader Benitez Thompson, which would revise the provisions to the membership of the board that would mandate that one of the registered nurses on the board be a nurse practitioner. Currently, we have 2 nurse practitioners on our board, but that isn't a mandate. This would mandate that a nurse practitioner be a member of that board. And so those are our 2 primary pieces of legislation that we are looking to enact this session. And I am prepared to answer any questions.
Thank you so much, Ms. Denauer. Let's see, committee members, do you have any questions? I believe I have one from Assemblywoman Considine.
Thank you, Chair Howdigi, and thank you for the presentation. My question is, where do we stand on nurses per capita, or how many do we need to make up for our shortage? Can you answer that or give me an idea of where I can find that?
This is Kathy Denauer, and I don't have that information. That would be more through probably Owen or through the Workforce Consortium. I don't have that. I can certainly see about getting that information for you.
Thank you very much.
Committee members, any other questions? Okay, I don't see any hands.
Yes, Madam Chair, if I could ask a question.
Absolutely, Vice Chair Carlton.
Thank you. So as far as licensure goes, basically the same question I had asked earlier today of the medical board about how long does it take to do your licensure process. I know you mentioned for a temporary license, it's 3 to 5 days. I believe for full licensure, it's pretty close to that, but I just wanted to find out. And if you had a lag time on fingerprints also.
Thank you for the question. Yes, you are correct. Getting a license, a temporary license, is about 3 days. That's what it would take when you're endorsing into the state. It's about the same length of time if you've completed those fingerprints. There is a lag time right now. We're at about 10 weeks waiting for fingerprint results. That's a little bit out of our control, but we just get them when we can. I mean, we do them and we process them. We have somebody working full time on processing fingerprints, but it is about 3 days now. For somebody who has just graduated from nursing school, or this is an initial application, it might take a month or so to get that license process, because there's a little more paperwork to do as far as getting the transcripts reviewed and that sort of thing. But for somebody coming in that already has a license from another state coming in, it's a pretty short window.
And thank you, Madam Chair. If I could do a quick follow-up. So out of the little over 63,000 nurses that you have licensed now, could you tell me how many are active and how many are inactive?
I would have to get that for you to find out how many are active. These are the number of licenses that we have, and I believe these are the number that I gave you are the active ones, but I'm going to make sure with that, and I will get that for you.
Okay, thank you very much. I appreciate
You bet.
it. Thank you, Madam Chair.
Thank you for your questions, Vice Chair Carlton. And Ms. Nauer, I just had a couple of questions. I know that you said for the fiscal year you had 7,700 applications, but would you, if you don't have the information now, if you could get it to us, that would be great. But would you be able to tell us if all 7,700 were issued licenses?
There were, this is Kathy Denauer again, there were denial, there were 75 total denials, applications denied in fiscal year 1920. There were 4 that were denied by our board and 71 that were denied by staff. Staff have the option, we have policies that they follow and that they can do that. So otherwise, the rest of those applications were processed. I hope that answers your question.
Yeah, and could you give us a little bit more detail into like what would cause staff to deny an application?
Sure. So a denial of an application, when somebody is filling out an application for licensure, there are some questions that they must answer. Have they had action taken on their license in another state? Have they had a conviction? Do they have a felony? Those sorts of things. And then that kicks their application out of the queue, and it is reviewed by an individual who reviews all those, what we call the yes answers, anybody who has answered yes on an application. And so those sometimes would have to, perhaps they would have to, an action taken in another state. Let's say somebody had a license in California and their license was revoked and taken away from them, and they've come to Nevada now and they want to practice. That application would have to go to the board for their review. That would be an example of something that might be denied.
Can the applicants appeal the decisions and come before the board?
Yes, there's a due process for them. They can come in if they are told, hey, this is going to, all applicants, nurses have the opportunity to come before the board and plead their case.
Okay, and then I know I just had one last question. I was just curious, your board members, how long are the terms and how many terms can each board member serve?
Right now, it is a 4-year term, 8 years total.
Okay.
2 terms.
Okay, I think that's all the questions I have. Committee members, do you have any further questions? Okay, seeing none, thank you so much for your presentation, Ms. Denauer. We appreciate your time this afternoon.
Thank you.
Okay, committee members, we have one last item on our agenda, and that's public comment. Broadcasting, do we have anyone on the line for public comment?
Chair, the public line is open and working, but there are no callers at this time.
Okay, we can give the people who are listening on the internet a couple of minutes to call in, and members, if we would just stand at ease to give people time to call in for public comment.
Okay.
Broadcasting, has anyone called in for public comment?
Chair, the public line is open and working, but there are still no callers at this time.
Okay, thank you. Okay, committee members, that concludes our business for the day. Our next meeting will be on Wednesday at 1:30. We are adjourned. Thank you.
Thank you, Chair.